One of the things about David is that he is a physician that has a different kind of practice.
He has a way of being compassionate and also being matter of fact.
His practice is community health. His practice is environmental health. His practice is pushing public policies that impact health.
David's leadership comes through in sort of a wide range of ways.
And I think he has really brought to the forefront the fact that policy development in a whole variety of areas is really important if we're going to improve health.
Plus, just, you know, the passion to get in there and do it. It takes a lot of commitment to deal with the types of issues that David is doing day in and day out.
Hi, buddy.
Well, one of the things that motivates me in my work is all the calls we get from parents. And typically it's about something like this, and a parent says, which of these do I buy? Well, what about bottles? It is the same deal. It's another systems problem, because right now the manufacturers of these bottles don't need to tell the parent whether that bottle has bisphenol A in it. We really have a couple of different focuses. For that universe of 80,000 chemicals already on the market, we really think that as a society we need to grapple with some of the worst actors to identify the most persistent, the most toxic existing chemicals and start working on a plan to phase them off the market. I'm talking about the kinds of things that end up in breast milk, the kinds of things that when they're created, like many Teflon chemicals, almost never disappear from our environment. And we really think they ought to be targeted for eliminating them from commerce. And many of them have safer substitutes already on the market. So it's not a matter of finding something new. The something new already exists. It's just a matter of moving towards that safer alternative. We can create a system that is based in health, and basically it would say that we need more testing before we put a product on the market so that we know from a full range of toxicity testing what the possible problems are with that product. If we had that kind of system in place, it would give an incentive to the manufacturer to replace their more toxic ingredients with less toxic ones over time. At the same time, there's this exciting new way of approaching product development called green chemistry that basically says that you can design products intentionally with fewer toxic ingredients, using less energy, and creating less waste. We're seeing that there's a different way to approach product development that's not only better for their bottom line, but better for community health in the end too. The other thing we want to do is to really transform the way people think about our economy. Most of these 80,000 chemicals are derived from fossil fuels, from natural gas and from petroleum. Many of them could be substituted with things, with chemicals made from things that we grow, so from renewable resources. Minnesota could be a huge leader in growing these future feedstocks for products. We've got the know-how, we've got the technology, and we're in the breadbasket of the U.S.
Policies have to catch up to this growing body of knowledge. So there's a governmental role, there's certainly a citizen role, and then I think the environmental world has to also, in terms of the NGO or nonprofit world, they have to embrace the fact that we're going to need multiple messengers who are going to carry this new knowledge into all kinds of areas, because change has to happen at so many levels. It's going to take many people working together, and that will in fact bring about change. And we need champions like David who can articulate the science in the public discourse in an understandable way. And that's what is one of his great gifts. Well, we need many more Davids.
He has brought sort of the environmental health issues to the medical community, but he has also brought the medical perspective to the environmental health community. So he's been a wonderful bridge between these two major forces in our society that really do need to work together to improve the health of the environment and the health of the population.
I truly appreciate David's work. I also appreciate the IATP's work. The work is, you know, it's broad, and it's just really beneficial to the quality of life for people all over the planet.
He blends the passion and the knowledge and the expertise and the data in a package that is unique.